evidence-based public health focused policy which advocates the legal regulation of all drugs. We want to make this policy as ambitious as possible, and we want other parties to steal it. We've looked at comparative countries, other countries which have tried to implement things within an existing prohibitionist framework. One of our short-term policies is really to encourage the decriminalisation, which is to move away from the policing, for example, of cannabis possession.
York University did a study quite recently. It was actually saying that crack cocaine use has gone up amongst young cohort under the current system that we have.
Why is the party gone towards legalisation and regulation rather than decrim?
We're not against decriminalisation. It's great. It won't solve the basic problem, which is, the entire structure of prohibition. It won't guarantee a safe supply of drugs. It won't guarantee an end to the toxic drug supply.
Hello, welcome to Drugs Unwrapped with myself, Rob. Today I'm delighted to be joined by Dr. Carrie Hamilton and Michael Wakelyn-Green from the Green Party Drug Policy Working Group. Carrie, Michael, hello, how are we?
Great to be with you, Rob. Thanks so much for inviting us.
Yeah, thank you very much, Rob. Yeah, doing good. Cheers.
No worries. Yeah, thank you very much for your time. Really, really appreciate it. And it's quite a topical kind of debate that we're going to have today. Obviously, with the election soon coming up and what's happened recently in Gorton and Denton as well. But before we kick off, Carrie, if we come to you first, you okay just telling us a little bit about yourself and ultimately your involvement within the drug policy working group within the Green Party?
So I've been involved in the Green Party of England Wales for about 10 years, and I'm based in Hackney in Northeast London, which is really relevant to my involvement in the drug policy, actually, because it was in 2018 that our current mayoral candidate in Hackney, that is for the upcoming May elections, Zoe Garbett, and Alex Armitage, who's now actually in the Shetland Islands, and so he's involved in the Scottish Green Party running there. They both came out of a kind of NHS health workers background, got together and decided that it was time to revise the Green Party's drug policy, which at the time was very, very small. I think it hadn't been revised since possibly about 1990, and it was mostly focused on cannabis at that stage. And we realized that a lot had happened in the world of drugs. So they invited me and I, with Alex and Zoe and a number of other people in the party, some other people in London, some of us some people from other parts of England and Wales got involved. And there we go. We set about revising the drug policy and presenting a policy which, to kind of summarize, is a evidence-based public health focused policy which advocates the legal regulation of all drugs.
I got into the Green Party probably about 4 years ago now, and it's been really nice to be the current comms officer for the Green Party Drug Policy Group with this big, huge green surge that's happened, really in the last 7 or 8 months or so. And it's been really good to see our Instagram page, which I would ask your followers to also follow us on all our other socials, because we do put out good content on there, has really picked up, and we're very proud of that, and of course proud of our evidence-based policy. Before joining the Green Party, I was in the Labour Party for about 8 years. So I joined under Miliband and I left after during Keir Starmer's first couple of years. And for me, professionally, I've been working in the sector in community substance use services, but currently, and I do not represent my employer here, but do work in the NHS as an alcohol and other drug specialist in the inpatient mental health setting. And so my current job, also my own experiences with substances, not all positive. certainly not, has kind of brought me to where I am now, talking about drug policy so passionately, because it impacts so many people's lives in a variety of different ways, and unfortunately really tragic ways. And yeah, we're fighting well, and what we're advocating for is popular as well. And I think that's resonating with people, and that's why we're leading in some polls. We're climbing well, and I think actually our perspective on drug policy, it being honest, is part of that as well.
Yeah, we'll get on to obviously some of the specifics around what Green Party is advocating for, primarily, like you said, Carrie, in terms of legalisation and regulation of drugs. But within the Green Party's policy document, then obviously looks at more short-term related policies that ultimately can be taken within our current legislative framework. Right. What are those short-term policies looking like?
Yeah, I mean, this is a really good point, because getting to Michael's point,
it's more than just legalisation, isn't it?
Yeah, no, it really is. And it's really interesting because, it's important to remember when we wrote this policy, we had one MP. I remember one of the things that we were talking about is that we want to make this policy as ambitious as possible, and we want other parties to steal it. So the idea that we're now thinking about not only having a short-term policy which we might be able to implement while another party is in government, but also potentially within the next general election, holding some kind of power in Parliament in Westminster, and actually being able to put forth some of the longer term policies. So you're absolutely right to ask about both. I guess probably your listeners will be familiar, but the thing about prohibition is that it kind of controls everything related to drugs. And so we've looked at comparative countries, other countries which have tried to implement kind of things within an existing prohibitionist framework that follow kind of harm reduction and public health principles. And also, I really want to stress that the policy very much is a Green Party policy. So it has environmental justice, social justice, economic justice, racial justice, recognition of women, queer people, people with disabilities, and so on at the heart of it as well. So it really is a green drug policy. So, an example of that, one of our short-term policies is really to encourage the decriminalisation, which is to move away from the policing, for example, of cannabis possession. So that's something that the individual police forces can make a decision to do. So and there are some areas of Hackney, there was a report recently in Weston, in some of the kind of Western boroughs, like I think Twickenham and Richmond, where the rates of stop and search of young black people are something like 50 times or 40 times higher than they are white people. And a lot of that is done on a kind of suspicion of, or the excuse is suspicion of cannabis possession. And even here in Hackney, the numbers are really uneven. So kind of working with local police to try to deprioritize, or the London Metropolitan Police, which is something that our London Assembly members, such as Zoe Garbett and Caroline Russell, have tried to do in London. So that's an example. Also, diverting people away from the criminal justice system. So if people are picked up for a minor drug possession, rather than sending them to prison or sending them to court, arresting them, giving them alternative sentences, or sending them, of course, into treatment programs. And the other kind of harm reduction measures would be things like, ensuring that all police and the general public has access to naloxone, which is the substance that can reverse an opioid overdose. And there are police forces in the country that carry them. Also, overdose prevention centres such as the Thistle in Glasgow. We'd love to see an overdose prevention centre, many of them actually opening in England, in the areas where opioid and increasingly also cocaine-related overdoses are happening. And drug testing, of course. And in fact, the Loop, which is a drug testing charity, is about to, or has just opened its first drug testing center in London, in Camden, I think. Which will also serve as adjacent boroughs, including Hackney. So those are the kinds of things which, but to basically depend on local police forces being willing not to prosecute things that they know are for, the health of the community. So they don't require a change of law. They require, the cooperation of the police. Education is absolutely, in fact, our number one short-term policy, which is to, and to tell the truth. One of our principles of our policy is to be honest with the public about drugs, their impact, their potential harms. And that includes being honest to young people, which is why it was so infuriating in Gorton and Denton, although not entirely surprising that Labour would choose to tell just outright lies about the Green Party's policies regarding young people and drug use. Because the policy is certainly not either aimed at changing kind of, the legal age of consent around drugs, nor would it be the idea actively to encourage people to recognize that people, including people under the age of 18, are using all sorts of substances, some of them without really having any idea what they're using, putting themselves in potentially very bad situations. And at the same time, they will continue to use those substances. They want them to know what they're using, how to use it safely.
And talking about like drugs like crack cocaine, the Labour smears that the Greens want to give children crack cocaine in parks, absolutely ridiculous. And actually, when you look at the statistics, I think York University did a study quite recently. It was actually saying that crack cocaine use has gone up amongst young cohort under the current system that we have. So actually, under the Labour government, there's more children using crack cocaine than there was before. So actually, I think that's quite a self-report there from the current government, and obviously the policies over the last half century just totally failing to keep up with the demands of an evolving drug market, but also just actually it's not fit for purpose in 2026. And I think, and you saw it in the comment section of Labour's, they were getting totally ratioed. They were, the comments were just slapping around the Labour ads. And I'm so happy because we didn't have to do that. The people were doing it. People were like, oh, hang on a second, that doesn't make sense. You look at these countries, they're doing something differently. There's definitely more of a public consciousness around evidence-based drug policy. Take overdose prevention centres, for example, and actually in the Welsh context, I think is really, really important.
Yeah, absolutely.
Wales in 2024 had the highest rates of drug-related deaths it's ever had, and again that's mirrored across the rest of the UK. And we are, one of being a patriot, I'm so happy that we're leading Europe in drug-related deaths. I'm not, obviously, and I think that's a really big stain on our country that we know what the answers are, but yeah, we're carrying on with the same broken system. In Wales, in particular, you had 417 overdose deaths, which is 40 more than previous year. And you think of how many of those deaths could have been prevented if you had something like an overdose prevention centre. Overdose prevention centres, which are clinical spaces where people can come use substances with clinical supervision, that if an overdose was to occur, that the healthcare professional, someone like myself, someone like Carrie, could bring that person back. It allows that person to also have access to other incredibly important healthcare provision, whether that be housing, whether that be financial support, maybe support with gambling, because a lot of these issues are very co-occurring. And actually, again, this is an area for the Welsh Greens to improve on, is they mentioned about drug education, as Carrie said, incredibly important in our policy. That is reflected in the manifesto, but something like overdose prevention centres isn't. And the issue is as well, there is a precedent for it. As Carrie said, the SNP managed to kind of get one up in Scotland. So they did actually cut a lot of the service provision historically, but they did manage to get an overdose prevention centre in Glasgow to tackle the incredibly high overdose deaths there. And when we're trying to win hearts and minds, I'm like, how can our drug policy not be a popular policy? As I said, it saves lives, it reduces crime, it improves healthcare outcomes. It's definitely something we should be leaning into as part of creating a happier, healthier and safer communities. And I definitely urge society to, but I definitely urge the Green Party to as well. Kind of what I fear perhaps at the moment is almost the Lib Demification of policy, that kind of lick their finger, put it in the air and kind of say, how can we triangulate to try and get no, we should be doing our bold politics, standing with what is right, standing what is evidence-based, and people respect that. They respect what we're doing. And as I said, our drug policy definitely resonated with people in Gorton and Denton. The fact that Labour highlighted it so much and got totally ratioed fills me with joy, having been in that campaign that was campaigning for these policies.
Yeah,
what we're doing is really good.
We've kind of already dived into legalisation and regulation already, but take a step back then. So what's the difference then? What's the difference between decriminalisation and legalisation and regulation? And ultimately, following on from that then, why has the party gone towards legalisation and regulation rather than decrim?
So decriminalisation is, for example, the possession of drugs for personal use could be decriminalised. That would no longer be a criminal offence. That can be done without changing the whole framework of prohibition. Someone could still be arrested and would be arrested for dealing. It wouldn't be, nothing else would change. And for us, prohibition is a system, a structure that's been in place now for over 50 years, as in the case of the UK since the 1971 Misuse of Drugs Act. And in fact, it goes, back earlier than that for various substances, which allows all the kinds of things that, Michael was talking about. For one thing, the entire drug market to be in the hands of organized criminal organizations. And it also ensures that with all the associated, harms that go along with that. And it also ensures that there's no way of controlling the substances themselves. So again, people have no way of doing so. So it's great. So we're not against decriminalization, but we don't think that it won't solve the basic problem, which is, the entire structure of prohibition. There can't be just decriminalization of drugs without, it won't guarantee a safe supply of drugs. It won't guarantee an end to the toxic drug supply. And one of the things that I always, although there has been a pretty awful backlash in Canada against some of the, very important harm reduction programs that were introduced in that country, because you look at somewhere like, it's all over the country, but Vancouver in particular, British Columbia in particular, in the west of Canada has had an absolutely terrible drug death rate for the last, about 15 years. And one of the things that, in spite of all the backlash, the drug user rights movement and the harm reduction movement in Canada has managed to do is introduce the concept of safe supply into the popular language. People understand what a safe supply of drugs is. Even people who aren't very experienced with drugs and drug policy reform. And so people get the idea that, like, you again use the comparison of alcohol. Like, I don't want to go to my off license and not know that what I'm buying, when I buy a bottle of vodka is not what, like, it's not going to be what alcohol. Like, that's a no-brainer. People understand that, and that happens because alcohol is very closely regulated. So I think that and I'll be honest, for some people, we've been talking about the hard sell for people maybe who are a bit more conservative. Demanding legal regulation can also be a hard sell for people on the anarchists, for example, who don't want the state to be heavily regulating things. And my response to that is, well, if we can figure out another way to regulate drugs and ensure that people are taking what they think they're taking, then okay. But I don't really see at this point how that can happen without regulation. And it's certainly not going to happen when there's a vested interest on the part of people who are selling drugs illegally to put whatever the hell they want into those drugs in order to maximize their profit. The Green Party is also a party that's critical of over-policing and violent policing. And the policing of drugs and people who take drugs and people who deal drugs and trade drugs is one of the top, and over, the overpopulation of our prisons. The entire structure of prohibition has a huge role to play in all that. This idea that the police have to protect the society from drugs and the bad people who do and trade drugs. And so if we want to deal with, over-policing, violent policing, racist policing, we are going to have to deal with we're going to have to attack prohibition.
Just on the point again, decriminalisation versus legalisation. So a lot of people felt that our policy was just decriminalisation. Actually, I mentioned earlier on about public consciousness, about different approaches to drug policy, internationally. And a lot of people cited Portuguese model of decriminalisation, which has been fantastic at reducing drug-related deaths, in particular, actually, bloodborne viruses have been very effective in that, and actually getting people into treatment. Fantastic. That is Awesome. Actually, Professor David Nutter was on your podcast the other week, notorious for getting sacked by the Labour government for saying that more people fell off of horses each year and died than taking them DNA. He said about what decriminalisation was something he would do like that, because we've got a model for it and we know it works for the purposes of public health, and that's really, really important. But yeah, as Carrie said, legalisation actually taken out of the hands of that organised crime, regulating the product in and of itself, is also really good harm reduction. Knowledge is power, and when people know what's in the substances they're taking, they're able to make better decisions about what they're putting in their body, again paired with that short-term policy of education that we're talking about. Legalisation also allows, I think, skilled jobs. Yeah, we look at places like Illinois in the cannabis industry there, being able to create apprenticeships, get kids that would otherwise be maybe pulled into drug gangs, actually give them skills, give them education, like horticultural degrees in distribution that they can then take forward with them and apply to different industries. It's a fantastic economic and social stimuli. A big point that I made as well when I was in the Labour Party about kind of in particular legalising cannabis was about the slavery that's involved in the industry. So again, the illicit drugs industry is also very much tied to a lot of other illicit industries, including human trafficking. And I'm sure as well, when we're talking about capturing that illicit marketplace, if people were given the option of, being able to buy cannabis, that they actually knew how much THC and CBD was in it, so they can make more educated decisions about what they're putting in their body, what was perhaps more likely or less likely to cause a drug-induced psychosis, they'll probably go, you know what, I'm going to play it a bit safe, have something with a bit less THC. But if they also knew that slavery was involved in the creation of it, I think people would be much more drawn to that industry. That could be, as I said, regulated, people knowing what's in it, but also then you could take that tax and actually put it back into drug education in schools, back into our NHS provision, while also, again, getting those young people that otherwise would be involved in criminality into a legal regulated industry. The drug policy impacts so many different areas of society. It kind of feel like a spider's web. It kind of ripples across the whole thing. We're talking again housing, public health, family breakdown, youth services, work, jobs, careers. It impacts so many different areas. And as I said, when we're talking about holistic view of society, and I keep saying it, I'm going to keep saying it, more happier, healthier, and safer communities. I think, drug policy is a fundamental component in that, and we should be leaning into it more. And what we're advocating for is a science-based approach that puts communities and people first. And that is resonating with people when they are allowed to hear it, when you have people like myself and Carrie championing for it. As I said, and obviously Zach, of course, has been doing the rounds well. He's been talking about our drug policy, and he has really kind of thrown this into the public conversation. But I definitely think much more needs to be done on it.
If drugs were to be legalized and regulated, it wouldn't be a free fall, so what would it actually look like in operation in terms of from one drug to the next? Are we talking about cannabis and heroin and crack cocaine all being regulated the same, or would it be specific on each drug?
So the way the long-term policy is now, which is the policy that we would hope to implement as a party in power, whether that be the main party or as part of a coalition, would be evidence-based and around the potential harms related to each substance. Now, we say this with, of course, the caveat that there are all sorts of factors that determine whether a drug is harmful. The context in which it's used, how much is used, the dose, obviously, and of course the person using it. All sorts of things to do with their own history, health history, among other things. But that said, we can nonetheless see that there are certain, of course, risks, as I said, associated with certain substances. And so a substance such as heroin, we would not currently ask for heroin to be, or indeed opioids, to be available to the general public for recreational use. And instead, the emphasis would be on making those drugs available to people who need them for maintenance therapy or as part of kind of treatment. And the same would be true of methamphetamine, for example. Now, in the case of or crack cocaine. Crack cocaine is slightly more complicated in the sense that I don't think whereas there are many, many, many examples of, heroin-assisted therapies, so that is people can get it on prescription. Crack cocaine is slightly different, so, that's something that we have said in our current policy that we would look into kind of piloting, but that's there aren't the kind of comparisons that one would be able to use. Now, the difference between, of course, as you know, crack cocaine and heroin is that cocaine is available also in many other forms. So what we would say in the case of cocaine, similarly to what we would say in the case of amphetamines, is that the aim would be to direct people who wanted to use those drugs recreationally to forms that are less likely to be harmful. So it's lower dosages. So it's something like cocaine, actually it's the drug that could be perhaps available in clubs in very, 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 very tiny doses of coca in a drink, for example, or as a lozenge, which would have the kinds of effects that the coca leaf has in the Andes, in communities that have been using it for millennia, whereas cocaine powder would be a much more restricted drug available for recreational use only through specialist pharmacies. MDMA, for example, could be available again in very small individual doses, think perhaps in drinks at clubs, but that would have to be then again controlled in a similar way that alcohol is. Staff would have to be very much trained to ensure that any of the kind of potential harms that are associated with MDMA that people using it would be aware of, and that they would be trained to deal with that. Cannabis, we've looked at the model of cannabis social clubs in countries like Spain. And by the way, it's not surprising, that all of these kinds of proposals that we're making, or kind of, the system of regulation, would be to encourage people to use these drugs in a social context.
Yeah.
So that they're recreational drugs, so that we're moving away from a system, and again, as Michael has said, this really has to be seen as part of a holistic system, so that we're moving away from a system in which people become dependent on substances because they are dealing with all sorts of other kind of issues in their lives, whether that be untreated mental health trauma issues, whether that be lack of housing, lack of employment, poverty, and on. So basically self-medication, and recognizing that, people want to use drugs in many cases, that they can increase, like come back to the case of MDMA, there's lots of work done on the ways in which MDMA, particularly in club contexts, at raves and at festivals, really enhances people's experiences of human relations in very positive ways. So it's the answer to the short answer to that is that no, all drugs would not be regulated in the same way. The statistic of problem drug use, generally hangs around 10 to 12%. That is about 80, the estimate is about 88 to 90% of people who use drugs do so unproblematically in a way that does not lead to dependency and serious health and other problems, and for themselves and other people. And I think we need to have a policy that recognizes the needs of that 10 to 12% and actually has their needs at the core of it, but also recognizes the rights and the needs, the social needs of that other 88 to 90%.
The money generated then, obviously at the minute under current laws, legislation, it all goes to organized crime and such like. The money generated then under this policy and under this proposal, where does that go to? Is it similar in terms of, like, for example, in Uruguay, it goes back into, in terms of cannabis regulation in Uruguay, goes back into like healthcare, education? Is that something that would be similar
I think our
here.
policy has a non-profit motive at the core of what
Mhm.
it is doing, and actually, it's less about money generated, but more money saved. And again, it's capturing that illicit market is at the core of what it is, because we want to be reducing crime in our communities. You know, we want people that are reducing the harms of the substance use itself. And again, our policy works towards that end. When I said about our policy being realistic, well, our policy reflects that people will use drugs. They always have throughout human history. They always will. Also, our policy is, I like that our policy also works in conjunction with our kind of cultural policies as well. So take alcohol, for example. We also want to better regulate the legal drugs we have at the moment. So we know that alcohol is one of the most destructive drugs in our society, and it does need to be regulated better. What we do want to do is, however, encourage people to utilise, well, drug consumption rooms, pubs, and actually go out to pubs and clubs. So, for example, we would want to increase the cost of alcohol for people taking it, back home. End the deals at your friendly neighbourhood supermarket drug dealer. We get 6 bottles for the price of 5. But actually, we would reduce the cost of alcohol being sold in pubs, because again, we want to encourage people to go to those third spaces, keeping those venues alive, keeping those jobs alive, but then properly utilising the recreational social aspect of those substances. And that's something that's really important. I suppose, especially for myself, being a young person, I'm turning 30 this year, there's such a lack of third spaces. Pubs are closing down. The local bowling alley in my area, that's gone now. These third spaces don't exist anymore. And it's tricky to meet people. It's tricky to form those human connections as readily as it would have been 20, 30 years ago. And I think there's definitely a desire, especially why the Green Party is doing especially well amongst young people, is because we have a desire to create those third spaces. That's how you tackle the mental health crisis. You create those human connections. And again, if substances in a safer and regulated way help lubricate that, awesome, brilliant. Why would that not be something want to utilize? Again, so going back to your kind of question about the kind of profits, as I said, it's about the money that we save. That's the core of what we're doing through the social costs of what we've currently got. If we're not having 5,500 people dying each year as a result of illicit substances, that's a lot of people, that's a lot of families. What we've got at the moment is a really tragic indictment of the direction of travel in our society, and it is emotive. It is upsetting, and it's especially upsetting when you have those deaths being totally ignored, and the people who have passed away being totally stigmatized and vilified. I think our pragmatic approach takes a really broad view of the issue, and actually creates a lot of the solutions to not just the drug problem we have at the moment, but actually is a component in fixing a lot of other problems we have in society as well. And that's why it's resonating with people and should be leaned into much more.
Last couple of questions, just very briefly. Firstly, then, has there been any thought around easing any international relation kind of tensions, especially given that the UK is one of the main signatories to various UN conventions that ultimately a legal and regulated framework would essentially contravene those? Has there been any thought around how to overcome that, and I guess lessons learned maybe from the likes of Canada and even the US, I guess, from a state level? I know they kind of use the federal law as a kind of a way to get around it, but has there been any thought process around that aspect?
I mean, there are two kind of parts to that. On the one hand, you're absolutely right. We do have, we're signatory to this UN convention. Even if the Green Party would immediately get rid of the Misuse of Drugs Act and replace it with a system of full legal regulation, we would be party to international law. And those are things that, like any government does, I think, the other two big international issues which come immediately to mind are, of course, climate change and militaries. Yeah, we're also so embedded in an international globalized system that would have to, that's something, how that would look, whether that would, of course, bringing Britain back closer to the European Union, potentially eventually back into the Union, I think would help to ease some of those differences, because then we would be, again, closer to countries like Portugal, who have already, and other countries in Europe who are, have less who have already moved away from, I mean, I don't know if you're aware that, for example, some mayors in Europe and other parts of the world, including Colombia, are advocating legal regulation of the cocaine market, for example, precisely because of the impact of the criminal organizations on their cities, their port cities. So I think that, breaking our isolation will be a big part of that. And there's I'll be honest, there's a kind of, there's not only in our kind of organic understanding of drug law, but a kind of utopian thrust here that, perhaps we could be, the UK could be the first country completely to overturn prohibition, and then we would be a leader in that kind of internationally. But you're absolutely right that those things would have to be considered. I just want to say one other thing quickly in terms of the international aspect, and that is that we're absolutely committed to ending the devastation of the environment and societies and communities all over the world as a result of prohibition and the illegal drug market. So we're always, a big part of our understanding of what a humane drug policy would be, have our drug policy be working hand in hand with people in, say, Latin America who are trying to protect coca farmers and protect farmers generally, both from cartels and from, of course, corrupt and violent police forces. I'm thinking about a country like Mexico, for example. So we're really conscious of the terrible environmental impact of the so-called war on drugs in countries of the global south in particular. And so again, rethinking and getting rid of prohibition really does mean rethinking all of our kind of international relations in a way that very much, I think, does fit with green values around promoting global peace and also, of course, prioritizing the climate crisis. But it's we're very conscious that this isn't an overnight thing. And yes, it will be part of a much bigger renegotiation of Britain's place in the world, hopefully as a leader in humane policy across the board.
We could absolutely be a pioneer in this space. Also, when we're talking about international cooperation, as Carrie quite rightly said, there's so many opportunities to build really positive relationships with countries that have been really hurt by the war on drugs, and actually saying, well, now, again, we're talking about Brexit dividends and all that. Well, actually, why are we not doing trade deals? Why are we not working collaboratively with these countries? We set a precedent there that's saying, okay, we're not going to police your farms anymore, but actually let's utilize your farmers. Let's actually do proper fair trade with those places. And I think that's what we should be doing. We shouldn't be taking notes out of the US administration currently, or actually really Democrats either. We should be finding our own thing. We should be trading with our nearest neighbours. But as I said, we should be putting our local services, the people in this country who are losing their lives at increasing rates. We should be doing what works in this country, and we should be doing it a lot more. And I think we have to stand on principle. We have to stand on the evidence. We have to stand with the side of, I think it's a really easy sell. We have to stand on the side of less death, better public health, and better economic sense, simply put.
I guess from a UN perspective, kind of going back to that, I guess in terms of the likes of Uruguay, it kind of justified its reform, really, saying that, it's consistent with the treaty's overarching concern around the health and welfare of its citizens and ultimately sits within human rights as well. What's your response? What's the party response then when people say that essentially legalizing drugs sends out the wrong message?
Well, my response is that not telling the truth about drugs is sending out the wrong message. Not only it doesn't work, but I think that lying is just, as a general principle, lying to the population is never a solution. And claiming that prohibition is a way of lowering the risks associated with drugs is just a bald-faced lie. So I understand why people are scared about the idea of legalization, as they think of it, of drugs, because they have seen because they have been, lived in the system of prohibition all their lives. I think it's important not to be patronizing to people. So I think it really is kind of listening to people and listening to people's concerns and not patronizing them, but also, pointing to the evidence and also pointing to those human stories, which is why we do talk, we do a lot of work with anyone's child and other groups that represent, all of us who've been in drug policy long enough and have, lived long enough, have seen, have lost people to terrible drug laws. And, those are stories we also tell. I think kind of using a combination of, the principle of the truth, being really honest about drug deaths and what the causes of them are. And also, last thing I'll say is also being honest about the fact that people do drugs because they want to do drugs and in many cases enjoy them and get a lot of things out of that.
I think the vast majority of people across the political spectrum want happy, healthier and safer communities. And that is what our drug policy does. It is evidence-based. It's been proven to work in the places where our policies have been tried in the world. We've taken a pragmatic, science-based approach to these issues that are realistic. And I think we need to be talking about that much more in the Green Party. There's nothing organised crime want less than a regulated drug supply. And actually, when we're talking about being tough on crime, tough on the causes of crime, our drug policy does that. If you support that and you want that approach, Green Party drug policy does that in spades. Also then delivers as well for, the education of the nation, the mental health of the nation, third spaces for young people to kind of go to, again, it kind of lubricates those social interactions. And I think that's popular. I think we need to lean into it much more. And our current system of prohibition, the amount of drug deaths that we are having, the harms associated with it is a stain on this country. As I said, our policy seeks to rectify that, but not even just rectify, but actually greatly improve society as well. And I think that has to be the core of what we're doing. Drug policy, we need to be talking about it because it's such an important component of trying to fix the ills of society. And if we're not talking about it, we are unfortunately going to be falling short of achieving that goal. We would be remiss and doing a disservice to the people that we represent if we didn't. It paves the way for a much better society going forward. I'm really excited for the upcoming elections, for general election in 2029. If it happens, then it might happen a bit sooner, who knows. And drug policy I think should be it's a unique selling point for us. We should be utilising, we should be championing it as part of that puzzle of creating the society that we want to be creating.
Carrie, Michael, thank you very much for your time. Everyone else, we will see you soon. If you have been affected by any of the issues discussed in today's podcast, please reach out. Barod have a free and confidential live web chat service that is available 7 days a week on our website at barod.cymru, where you can chat to a trained support worker. Alternatively, you can contact Wales's National Drug and Alcohol Helpline, Dan 24/7, either by calling 0808 808 2234 or text Dan to 81066.